Today, we're going to talk about the most used and probably the most ignored piece of engineering that you own, your feet. I mean, think about it. They're the foundation for your entire body, but for most of us, they're a total afterthought. That is, until they start screaming for attention. And when they do start to hurt, you are definitely not alone. A staggering 80% of us will deal with significant foot problems at some point in our lives. That is literally 4 out of every 5 people. So yeah, chances are this is something that's going to affect you. You know, this quote really hits the nail on the head. It perfectly captures the foot's, well, its identity crisis. Imagine a machine that has to be a soft, squishy pillow one second, and then a hard, rigid crowbar the very next. And it has to switch between the two with every single step you take. That's your foot. It has to be flexible enough to absorb shock, then instantly become a rigid lever to push you forward. It's just an incredible piece of design. Okay, so if the design is so brilliant, what gives? Why do 80% of us end up in pain? Well, the answer is in its complexity. So to really understand what goes wrong, we first have to, pop the hood and take a look at the engine itself. Think of your body like a skyscraper, and your feet are the foundation. Now, what happens if there's a crack in a building's foundation? The problem doesn't just stay down there, right? It affects the whole structure. It's the same with your body. It's all part of what's called the kinetic chain. A little wobble in your ankle can throw your knee out of alignment, which can then twist your hip, and pretty soon you've got that nagging lower back pain that you just can't figure out. So just look at this list. With every single step, your foot is doing all of this at once. It's a sensor, it's a shock absorber, a stabilizer, and a motor. It is an absolute masterclass in multitasking that we do thousands and thousands of times a day without even thinking about it. All right, so to see where these breakdowns happen, we need to take a quick tour of what I like to call the foot factory. It's basically got 3 main departments, and each one has a very specific, very important job. First up, you've got the landing gear, the hind foot. This is your heel and your ankle, and it is built tough for one reason: to take that first jarring impact with the ground over and over and over again all day long. Next up is the midfoot, which is basically your body's suspension system. You know those arches that everyone talks about? They are not just for show. They're this complex spring system that smooths out the ride, whether you're walking on a smooth sidewalk or a bumpy trail. And finally, we get to the launch pad, the forefoot. So after the landing gear has taken the hit and the suspension has smoothed things out, your toes and the ball of your foot lock up. They become a rigid platform, giving you that powerful thrust to propel you into your next step. Now, this is where the real magic happens. It's a dance your foot does with every single step. As you land, your foot pronates. That means it rolls inward and flattens out to be that mobile, flexible shock absorber. Then, in a split second, it supinates. It rolls outward and becomes a rigid, stable lever so you can push off the ground. This seamless dance is the absolute key to a healthy stride. But what happens when that beautiful dance between flexible and rigid gets out of sync? Well, that's when the system starts to break down. And that's when we start to see some of the most common foot problems that you've definitely heard of. You can actually learn a ton about your foot structure with a simple wet footprint test. Seriously, try it. A normal arch leaves a nice visible curve, but someone with flat feet, their footprint shows almost the entire sole because that arch has collapsed. Then you have a high arch, or pes cavus, which often leaves a very thin print. This usually means the foot is too rigid and probably isn't absorbing shock very well. Okay, let's talk about one of the most infamous foot problems out there, the bunion. We've all seen that painful-looking bump on the side of the big toe, but what is actually going on under the skin? Here's the deal. It's not just a bump that grows out of nowhere, it's a full-on structural collapse. First, the main bone behind the big toe starts to drift sideways, inward. This pulls the big toe out of alignment, creating this painful angle. The body then responds to all that friction by building up extra tissue in bone, leading to inflammation and that classic painful bunion. But here's the great news. You don't need a doctor to start understanding your own feet. They are constantly sending you signals. You just need to know how to read the signs. Okay, here is a simple diagnostic test you can do right now. Go grab your favorite pair of sneakers and flip them over. Where are they most worn down? If the inner edge is shredded, you're likely an overpronator. Your foot is collapsing inward too much. If the outer edge is gone, you might be an oversupinator, meaning you're not absorbing shock very well. This simple pattern can tell you a lot about potential knee and hip issues down the road. All right, here's another huge factor: ankle flexibility. We're talking specifically about dorsiflexion, which is just a fancy way of saying how far you can pull your toes up towards your shin. If this movement is restricted, your body will find a way to compensate, and it often does that by collapsing your arch or twisting your knee. And yeah, there's an easy way to check yours. Find a wall and try this. Put your foot a few inches away, pointing straight ahead. Now, keeping your heel glued to the floor, see if you can touch your knee to the wall. If that's easy, move your foot back an inch and try again. Find the maximum distance where you can just barely manage it. Now switch feet. A big difference between your left and right side is a major clue that something's out of balance. So after all of this, why should you care? Because your feet are not separate from the rest of your body. Treating them well isn't just about preventing a sore heel. It's about protecting your knees, your hips, and your back for the long haul. And the forces they have to manage are just astronomical. With a simple walk, you're putting more than your entire body weight through that little structure with every single step. Start running, and that doubles. And if you jump, you're looking at 5 times your body weight or even more crashing down. To put that in perspective, if you weigh around 200 pounds, the total force your feet absorb in an average day adds up to 639 metric tons. No, that is not a typo. That is the equivalent of a fully loaded jumbo jet landing on each of your feet every single day. So yeah, they're the unsung heroes of your body. They are your shock absorbers, your engine, and your foundation, all rolled into one incredible package. So the final question is pretty simple. You have this incredible piece of biological machinery that absorbs the force of hundreds of tons, day in and day out. Are you giving it the care and attention it deserves? Because taking care of your foundation is the first step to building a stronger, healthier you.